Have you ever heard of the term MHO? Have you ever wondered why companies are required to deduct portions of your salary to pay for this? What benefit do we get for paying, and how much does it cover? Then, let me report it to you. I am Hasmin Baltasar of Group 4, reporting on managing healthcare expenses. American healthcare costs approximately $7,500 or more on each of the citizens. About 85% of the total population is covered by medical plans that shoulders portions of their total medical bills. Those who aren't covered must pay even more. One can obtain protection as an individual or as a member of a group. An entire group of people can avail a group health plan, and a good example of it is a company's offered medical plan. There are three types of losses. First, economic, second, non-economic, and last, punitive losses. These are losses resulting from injuries or illnesses that can be addressed in multiple ways. One can always pay for it directly using his or her own money, or it can be covered by the following. First, any type of MHO. Second, health insurance. And last, high deductible health plan. These are ways that may cover as much as 90 to 100% of the cost. Compromise the plan typically offered by the employer. Rehabilitation and custodial costs are often not covered by most care plans. Care plans tends to cover only the medically necessary, or in other words, it can only cover short-term medical needs. It can be covered if one has a long-term care insurance. It provides reimbursement the costs associated with the custodial care in a nursing facility or at home. For those of low income or low wealth, Medicaid is there to provide protections. MHO or health maintenance organizations are organizations that offer a wide range of healthcare services for a set monthly fee on prepaid basis. MHO members are eligible to receive healthcare services that include hospital, surgical, and preventive medical care. There are MHOs with small co-payment amounting like $5 to $20 for each office visit or prescriptions. MHO's goal is to identify any health problems to early reduce the chance of having a high-cost medical treatment. Its services are available to individuals or groups. They base their monthly fee on the medical services that a member often uses. MHOs do not limit the coverage of a member's healthcare costs. Instead, they provide a list of types of medical care that they will provide under the contract.
Good day, ma'am. Good day, everyone. I'm Ilustrisima Maria Mili. I have discussed about consumer driving. Refers to a system in which individuals have more control over their healthcare decisions and expenses. It often involves high deductible health plans paired with health savings accounts or health reimbursement arrangements. This model aims to empower individuals to make informed choices about their healthcare, promote cost-conscious decision-making, and increase transparency in healthcare pricing. It puts patients at the center of their care and encourage them to be more engaged in managing their health and incur costs. The next is making sense of your medical plan benefits. The first is save money. By knowing what services are covered and what costs you are responsible for, you can budget for medical expenses and avoid unnecessary out-of-pocket spending. Second is access care. Knowing which doctors and hospital are in your plan's network can help you choose providers that will minimize your cost and ensure you receive quality care. The third is stay healthy. Understanding preventive care services that are covered at no cost or at a reduced cost can help you stay proactive about your health and catch potential issues early. The last is avoid surprise. Avoid surprise bills. Being aware of any coverage, limitation, exclusions, or requirements can help you avoid unexpected medical bills that may arise from receiving care that is not covered by your plan.
Good day everyone, my name is Praja Anpirsimo from PSB HRTP. First, what types of the care are converged? The types of care converge can vary depending on the context such as healthcare, insurance or government program. Generally healthcare converge of the include primary care, specialist visit, hospital stay, prescription drugs, representative services, and sometimes mental health services, insurance, policies in government program like medicine or Medicare may have specific converge guidelines, so it essential to review the term of the policy or program to understand what types of the care are included. Second, whose is converge? The individual converge by an EC on their healthcare can vary based on the essay focus it on. Discuss healthcare converge for specific population, such as children, adults, senior, or individual with disabilities, attainability. It might address converge under different healthcare system, such as private insurance, government-funded program like medicine or Medicare or universal health care system. The scope of converge by also differ based on factor such as employment status, income level, or geographic location. Therefore, the essay should specific the demographic or group under consideration to explore to assurance of healthcare converge compensability. The last, those converge begin the end. Converge typically begin and the end based on the terms outlined in your insurance policy. This can vary depending on the types of converge. You have the specific details of your policy. It's important to review your policy documents or contact your insurance provider for accurate information regarding the start and the dates of the converge. So,
hey everyone, I am Janet Segovia and I'm going to discuss the when does coverage begin and end. So the beginning of insurance at January 1 at 12 a.m. and is December 31 at 11:59 p.m. is a coverage of a company in any illness. So company will shoulder you at company needs to give you a money for a hospital bill, and a coverage will continue if the plan expires while you're in the hospital, and absolutely yes. The second one is planning for long term. The key to successful long-term care is planning. Talk with your healthcare provider or family and friends if you're having trouble with everyday activities. They include walking, managing, financing, and driving. And also learn about the types of services and care in your community by talking to healthcare providers, social workers, family, and friends. And learn how much long-term care would cost. Find out how much the cost Medicare or your insurance plan will pay. You may want to look into long-term care insurance. And needing more care at some point, support from family, friends, and local meal transportation programs may not be enough. If you need more help with everyday activities, you may need to move to a place where care is available 24 hours a day. These may third one one is protecting your income during disabilities, and then most people know they should be prepared to cover income should the unexpected occur. But when it comes to saving money, knowing what you should do doesn't always translate into action. And risk to your income, major illness or long-term disability, leaving a job or being laid off and losing benefits. Proactive strategies know the risk as part of your regular financing planning. You and your spouse should discuss potential, and then create a plan should your income be lost and greatly reduced. And the second, months, and you can then calculate how much to save each month to fill your emergency saving, and then cut or reduce debt. Paying down or eliminating debt can be a critical factor in your ability to ed- endure a loss interest debt. And then line of credit, obtaining a line of credit while you still have income provides and reliable affordable resources that needed your benefits. And if you lost your income through job loss or layoff, injury, resignation, or disability. And that's all. Thank you.